I'm getting a lot of different questions about the hip and how to use ATG to target the hip in a bunch of different directions. I realized that my answer to this question wouldn't really fall into the typical line of the ATG principles of short to long range training. And if you're unfamiliar with those terms, go ahead and check out this video from our ATG for Coaches certification database for more. But as a snapshot, short to long range training refers to ATG concepts of training muscles based on length and torque. With short range training, there's greatest torque involved when the muscle is at a short length. This allows for greater mind-muscle connection and blood flow. And this was the rationale behind using sled for acute knee injuries. With long range training, there's greatest torque involved when the muscle is at a long length. This is important for structural development, sarcomere lengthening, and tendon and connective tissue resilience. I realize another category needs added to the range training criteria. This would be joint range. This concept refers to exercises in which the joint is the limiting factor in the movement. For example, sled is a short range movement. If I max out my strength in the sled by adding more weight, the limiting factor would be how much strength I could push with my quads. The Nordic is a long range movement. As the difficulty increases, the limiting factor is going to be the ability of my hamstrings to resist strength of gravity. But notice in a reverse step, as I load up in difficulty to increase the challenge, the failing point, once I get to a level that challenges my maximal joint ability, the limiting factor once I fail won't be the muscle to create strength, won't be the muscle necessarily to resist the strength of gravity, although both of those are present in this movement. It will be the ability of the joint to maintain tension in a joint range position. Here's a fail one way, and here's a fail another way. Both of these represent instances in which the joint is unable to tolerate forces at its joint range capability. Now, this is a crucial part of ability regardless of what area of the body we're talking about. This is because joint range opens up the gunk in the joint. This allows it to function better in space. Each rep done in a joint range dominant position allows for more mobilization of synovial fluid, breaking up of adhesions, and giving more potential for the muscles, tendons, and ligaments around that joint to do their job in sport and in life. So every rep that I do a joint range position, I'm getting more potential for muscles like the quadriceps, like the hamstrings, and for ligaments like the ACL, for the PCL, the MCL, the ACL, because the joint can now operate better in space. There's more fluidity for all of the different structures that surround the joint. This raises the ceiling for motions like reverse sled, Nordics, RDLs, deadlifts, squats, and even whatever particular sport or job that you participate in. Joint range, thus, is the foundation for short range and long range training. So then, how would I improve the ability of the hip joint to function in space? I would begin gradually working joint range in the reverse hip thrust, and gradually work up in height and weight that you can tolerate. A 10 rep max with a bent straight knee with knees behind toes, back leg straight, plantar flexed, lightly touching the ground on each rep, and controlling a torso angle at about 45 degrees. This joint range activity will help to mobilize the hip joint, opening up all the gunk inside of the joint, which will give more blood flow and healing in the synovial fluid to prepare the tissues around the joint for motions like